Tell us about this misinformation provided to consumers. What is it all about?
Well, I don't think it's really misinformation rather than misunderstanding or over-interpretation. So Council of Medical Schemes printed a list, regulated, and say, well, this is what needs to be paid, and this is the minimum that needs to be paid. Now, doctors also then got a regulation from Council that said, if it's a PMB, you have to pay at cost, meaning I can charge within reason whatever I want and get that reimbursed. However, there are very specific guidelines for these conditions. So just having the diagnosis, and this is where the misconception comes, just having that particular diagnosis doesn't mean that everything connected to the diagnosis will automatically be paid. And that is where a lot of the miscommunication and a lot of the anger comes from. Is I have the diagnosis, but they don't want to pay, because the severity of the condition may determine what's paid, or a certain clarifications and justifications will then say, well, yes, it can be paid. It can be paid cost.
Are these benefits made clear to the consumer when they buy a medical aid?
Well, medical aid's got a duty to really make sure that that any member and the beneficiaries understand clearly what is covered. Council of Medical Schemes has also gone out of their way, printing booklets informing the public, and also acting on behalf of the public, making sure that the public understands that. And it's also the last resort where public can go to and say, my medical scheme did not cover, should they be covering it? And then Council usually investigates that.
Doctor, please explain to us briefly what the payment of the PMBs are, the pre-prescribed minimum benefits, what it entails, because every medical aid scheme should have one.
Well, every medical medical schemes must all pay for prescribed minimum benefits. Now, it means if you have a provider network, you often contract with that provider network to provide those PMB services at a specific price as well. So if a patient chooses to go to a non-contracted provider, the scheme's obligation is to pay the cost that was contracted to the contracted providers and not at the choice provider of that particular patient. So there may be a co-payment, and that also often leads to aggression, say, but I thought the PMB must be paid at cost always, provided it's within the regulatory framework and it's within the guidelines and rules of the scheme.
So, for example, if your doctor, if you fall under the prescribed minimum benefit, charge you 100 Rand and you go with a doctor without it, outside the network, you would probably pay 20 Rand more, and you have got to pay it.
Could be. That's a good example.
Now, why has there been such an increase in the number of complaints to the Council, the Council for Medical Aid Schemes over the past year?
Well,
is it because of this misunderstanding?
I think so, and it's not new, and it takes time for something to catch on. So PMBs have been in for a couple of years now. The ruling to pay at cost is also, I think, is more than 18 months old already. But people are getting more and more aware of this, and they're also getting more and more aware of their rights into this particular environment. But it's also pushed by both the supplier and the patient saying, well, it was a PMB diagnosis, and the scheme would say, but you've never proved it to us, because the obligation is on the doctor and the patient to prove that it was indeed a PMB, and then the scheme must pay in full.
Now, how important is it for consumers, if you have a medical aid, that you speak to your healthcare consultant before embarking on an unforeseeable hospitalization?
I think that's one of the critical points that's not really happening. Patients, I always say, it's not like buying a can of peas. It's a different relationship between you and your doctor, but it's important that you have that discussion with your doctor and say, what is the condition? Have I got proof of the condition? And to what extent will it impact on my co-payments? And are you contracted in according to my medical scheme? So unfortunately, it puts a little bit of tension between provider and patient there.
Words of advice for consumers out there?
Well, make sure that you know what you're paying for. Make sure that you have a consultation with your doctor up front before you go for a procedure or before you embark on treatment.
And obviously all this information is available in your medical aid pack, I would assume.
It is, but like most people, we don't really read it all. So read the pack, make sure that you're well informed.
What about consumers that want to downgrade their medical aid schemes? What advice would you give to them?
Well, you must remember, a PMB must be paid whether you're in the lowest or the highest option. So the differential, just in a nutshell, between the lowest and the highest option is usually the ancillary benefits. Better dental, better optical, better different ward, less contracted network, you may have a more open network. So there are different benefits, and then you can get more chronic conditions than those only listed on a PMB. So if you're more elderly and you've got more chronic conditions, it's usually better to be in a bit more comprehensive plan than be in the lowest plan. If you're young and healthy, you may opt for a lower plan.
What about the difference between medical insurance and medical aid?
Well, medical insurance is insurance products not supposed to do the job of a medical scheme. So you're not supposed to offset healthcare costs. But insurance, you may have insurance for hospital cover where it's paid out a lump sum, but that's usually not to cover medical expenses, but it's usually to cover what's over and above that. Outside that, the family needing to travel and sort of discomfort and so forth coming up with that hospitalization.
So what would be your advice be with regards to that? Do you think it's a good idea?
I think you need to talk to your financial planner and discuss whether there's a need for that.
Doctor, thank you so much for your time. That was Dr. Jacques Snyman, the Managing Director of Integrated Risk Solutions at Agility Global Health Solutions.